what we are finding as we go out and reach out to people, what issues they are having, and how we can be in a position to help them. So without further ado, let me start with some of the questions that were left over from last week. The first was someone wanted to know about varicose veins. So varicose veins are those thick visible veins that tend to show through the skin, as you can see the vein, how it travels along the calf especially, and the thighs. So once varicose veins are well developed, it may require surgical intervention to get rid of them because they become quite swollen and quite visible, and it's hard to reverse this. However, what we can recommend is to use products, because this does tend to run in families and it can worsen with time. So if maybe you have a family, you've noticed that people in your family tend to have varicose veins, it means that possibly the vein walls are not very strong. And as the circulation becomes sluggish, especially around the legs, then there may appear these varicose veins or swollen veins that you see. So for that reason, our main aim would be either to deal with the ones which are not very well developed and visible, or to prevent them. Once they have become quite large and visible, it's not very easy to reverse the situation with supplements. So we recommend on the lifestyle side that you incorporate walking in daily routine, because walking is going to assist in improving circulation. You know that circulation slows down if we are sitting for prolonged periods. So get up and maybe even walk around your working space from time to time, so that your circulation keeps going. If you tend to have poor circulation, then we recommend also the use of compression stockings, which may help with circulation and avoid worsening of the varicose veins. Supplements may also help, supplements that can help in improving the strength of the vein wall. So the first recommendation would be flavonoid complex, which also contains some amount of vitamin C, and these will help in building up the strength of the veins so that they don't give way and swell up when the circulation is not too good. We also recommend multimineral alfalfa and omega-3 salmon oil. So that is varicose veins, and here I would recommend is better to prevent or to try to mitigate for worsening of the veins that have already become varicose. Then the next question was about nerve pain. So nerve pain is often, unfortunately, associated with other illnesses. So here, for example, we have the type 2 diabetes or pre-diabetes. So my first recommendation would be to check that there is no diabetes or pre-diabetes issues that has developed, because this can be one of the causes of nerve pains. There can be other causes. So the lifestyle recommendation here is to have practice gentle massage and exercises to try and ease the pain. And we have supplements that can also help with nerve pain. We have vitamin B complex, we have vitamin E and magnesium complex, and you can also add omega-3 salmon oil. So those are what we would recommend for nerve pain. But as I've said, it's important to, in such a case, to get to the root of the problem. And one of them could be diabetes or some other things. So maybe you can check with your doctor what, if you don't already know, because the question did not indicate. So just to know that nerve pain usually is a symptom of an underlying condition. So once you know the underlying condition, it becomes better. We become better able to address that, so that we give the body what it needs to resolve the issue. Then another question was from someone living in a malarial region and is having recurrent malaria. So just probably you are aware of this, especially if you have grown up in areas where malaria is common. We sometimes find that the germs that cause malaria can lie dormant in the liver and get reactivated and cause a new attack of malaria. So it could be that the recurrence is as a result of the malaria germ that is hiding in the liver, and every now and then would come up again as a new infection. Of course, since it's also an area where malaria is endemic, it would be likely that there can be reinfection because the infection can come around. And also certain seasons, the infections are more common than others. Let us say during the rainy season, when the mosquitoes are maybe more active. So discuss with your doctor medication that could possibly address the dormant malaria germs, because you may need a different drug from the usual malaria drugs if you have dormant germs that are hiding in your body. Then make sure to take the medication in the way and for as long as it is prescribed. One of the problems that happens here is if you take the medication to deal with the dormant malaria and the symptoms start easing off, then sometimes people decide to stop taking the medication. And that means that some of the germs might still be remaining in the system. So the medication for dealing with it should be taken as prescribed and for as long as prescribed until the dose is finished. Then on the lifestyle side, we recommend to use mosquito nets and mosquito repellent to minimize the possibility of getting bitten and infected. Also, in the areas surrounding our homes, we can make sure we drain any stagnant water, which usually is a place where mosquitoes breed. And also, we can plant certain plants that repel mosquitoes around our house, either in the garden or in pots if we are living in an apartment, so that we reduce the population of mosquitoes around us. Because remember, the malaria will be passed into us by the bite from the mosquitoes. So also to assist with this, we recommend the use of garlic allium complex. We recommend the use of vitamin A plus D, as well as vitamin B complex, just to help. But as I'll say, the first recommendation is to see your doctor and discuss medication that will address the recurrence. Okay. Then another question was an inquiry about a disc prolapse or a slipped disc. So these are the discs that are in the spinal column, and what they do is that they cushion the space between the vertebrae, that is the bones of the spinal column. And what can sometimes happen is that those discs may be displaced from the place where they are supposed to be, and this will touch a nerve and cause a lot of pain. One of the things to watch out here for in the lifestyle suggestions is to avoid prolonged sitting, because sitting is not a good position for our spinal health. So for that reason, if you maybe as a result of your job or whatever situation you need to sit for prolonged period, periodically take a break from sitting and stand, walk about for as much as you are able, so that the spinal column is not continuously under the stress of sitting down. Then the next lifestyle recommendation is to consult a chiropractor who can help realign the spinal column again and suggest massages that will help with the slipped disc. Then, of course, from Neolife, we also have supplements that are going to assist the body, and this will be full motion, will also be omega-3 salmon oil and vitamin C. These are going to help with the health of the discs themselves. But of course, as I've said, avoid the root of a problem, which is prolonged sitting, and also use the services of a chiropractor to help you to put the spinal column in good alignment. The next question was someone wanted to know what to recommend from for a person who is recovering from a stroke. And here, just to mention that once a stroke has happened, of course, we cannot prevent it, but it's important to be aware that having one stroke increases the risk of having another stroke. So the supplements will address the issues that are left behind by the stroke, but also help us to minimize the risk of having another stroke. So the recovery includes supplements that will help us to avoid a recurrent stroke. Again, here with the person who's had a stroke, consulting a physiotherapist for rehabilitative exercises and massages to deal with whatever might have been affected by the stroke. So the stroke might have left behind certain effects, maybe affecting our abilities here and there. Then we recommend lipotropic adjuncts. We recommend vitamin E, or alternatively wheat germ oil, which contains vitamin E. And then we also recommend Pro-Vitality. So these three supplements are going to assist in preventing any the stroke from recurring, and will also help by providing the body with healing the effects of the stroke. Unfortunately, sometimes the effects are quite severe, and it may be difficult to reverse those effects. Just because I'm seeing there is a hand up, I'm not able to attend to what you at this moment, because as you can see, I will be reading the questions and answering them. So whatever issue it might be, you can leave it in the chat, and we can look at it afterwards. Then someone wanted to know why it is that a customer they have who took CalMag and omega-3 was suffering from severe pain. Again, here they did not specify what kind of pain it was and whether it started as soon as they were using the supplement. So here, all I can say is that our New Life supplements are made from normal human foods and are unlikely to cause pain. The CalMag itself is made from chelated calcium and magnesium glycinate, both of which are very well absorbed and would be unlikely to cause pain. Of course, it's not impossible and it could be happening. So what I would recommend is to further investigate what could be the cause of the pain in case there is something else going on. But if the customer is insistent that the calcium and the omega-3 are the source of a problem, then I think what we normally recommend is ask them to return the leftover products, which you can go to the distributor service center and explain to them what the problem is. So then another question was what to recommend for an enlarged lung. So again, here, my first recommendation will be to consult your doctor to determine what would be the underlying condition that is causing the lung enlargement, whether it is something that is going on or it's something that has always been there, maybe an anomaly with which someone was born, and so on. So further investigation with the help of your doctor would be a good idea. And then we recommend here as simply as a way to assist with any possible lung issues would be herbal respiratory complex. We recommend flavonoid complex, vitamin A plus D, and omega-3 salmon oil. So these supplements will broadly address any issue that could be underlying the enlargement of the lung. And once again, please discuss with your doctor to find out what could be causing the lung to be enlarged. Another question was about glaucoma, which is an eye illness that can lead to impaired vision and even blindness, unfortunately. So here again, the cause is often not known. It might run in families, or it might be linked to blood pressure problems. But what we recommend for glaucoma would be carotenoid complex. We recommend omega-3 salmon oil and magnesium complex. And to be consistent with taking these supplements, because unfortunately glaucoma can lead to the destruction of the optic nerve, the nerve that connects the eye to the brain. Then Another question was about prostate cancer. Here again, discuss treatment with your doctor or oncologist. What maybe sometimes for certain types of cancer, they have got newer medications and treatments that might work better. And we also have very good supplements for prostate health. Here, of course, we see that the situation is cancerous, but it is okay to take the supplements in conjunction with the medication that is being used to treat the prostate cancer. So we recommend cruciferous plus, triple the normal dose, recommend chelated zinc and vitamin A plus D. Then the next question, someone wanted to know what to recommend for a young person who is living with sickle cell anemia. So here again, what we do not have anything that cures sickle cell anemia, which is a genetic illness. What we aim for is to maintain a good quality of life and to help in recovery from sickle crisis that is a common occurrence with people living with sickle cell anemia. So on the lifestyle side, it is very important to be well hydrated. And so drinking plenty of water is very, very important every day. In addition to that, there can be drinking broth and soups to ensure that the young person is well hydrated. We also recommend they avoid getting cold, because getting cold constricts the small blood vessels and can lead to crisis and pain. And then we also recommend gentle exercise, not high intensity exercise, because this might be detrimental to someone living with sickle cell anemia. A gentle exercise, for example, swimming, especially if it's possible to swim in a warm pool, can be useful. Walking, although not for long distances. So things like that. Then on the New Life side, we have supplements that focus on ensuring that the body is well supplied to deal with the ongoing problems that sickle cell anemia brings about. So the first recommendation is multi. The next is omega-3 salmon oil. We also recommend vitamin B complex. We recommend chelated zinc, flavonoid complex. And during crisis or when recovering from crisis, we also recommend using magnesium complex and the Neolife shake. This will help the body to recover from crisis. Unfortunately, we have not found something that can completely prevent the occurrence of this sickle cell crisis. But the thing to do is to work towards maintaining a quality of life and maintaining the health of the organs. And of course, today there is a cure, and this is a stem cell transplant. So of course, it is a costly treatment, but if a person is able to get a donor, a 100% matching donor of stem cells, then this is actually something that can completely cure sickle cell anemia. So then moving on, someone wanted to know what we can recommend for stammering. Unfortunately, in my opinion, I don't think that supplements can help with stammering or stuttering. And so what I would recommend in this case is to consult a speech therapist so that they can see how they can help the person with the stammer. Also, things like being mocked and being bullied can be a problem with someone who is stammering. And so they may also need other kinds of support so as to be able to accept their situation as you try to rectify them. So in this case, I will not say that I can recommend any specific supplement that will specifically address stammering. Then the next was at which time to take Calmag, the supplement. So this is a question that does appear fairly frequently. And in my opinion here, many people I find prefer to take Calmag at night before going to bed because they find that it helps them to sleep better. But for some people, it has no effect one way or the other on sleeping. So I would say that with Calmag, it's a matter of preference. You can take it with your meals, or you can take it at bedtime or in the morning, just as you prefer and find convenient. Okay, then another question was asking whether it is dangerous to consume steroids. I was not quite certain what this question was about, but just to say that our supplements are made from healthy human food, so we are not selling steroids as such. Some of the foodstuffs may contain steroid-like substances, but they are not the kind of steroid, for example, that people in bodybuilding and such fields use. So I would not say that it is a good idea to casually take steroids, but again, our new life supplements don't fall in the category of dangerous steroids. They are food concentrates, which would be part of a person's diet. Then another question was what to recommend for Parkinson's disease. So here we have two lifestyle recommendations. Opt for a healthy diet with minimally processed foods. There are certain kinds of Parkinson's that are related to junk food and sugar and so on. And then also gentle exercise should be included in the lifestyle that can, to some degree, help with the tremors. Then we recommend coenzyme Q10, recommend omega-3 salmon oil, beta-GAD, and botanical balance, just in case there is some sugar metabolism issues involved in the Parkinson's disease. This can also be checked, but those would be the recommendations for coenzyme Q10, omega-3 salmon oil, beta-GAD, and botanical balance. Unfortunately, illnesses such as Parkinson's and Alzheimer's usually start very much earlier on than you start seeing the symptoms. And so prevention is definitely important here, to be aware that an unhealthy lifestyle can lead to some of these illnesses, which are now more and more being linked to poor sugar metabolism and so on. So once again here, let's start early and opt for a healthier lifestyle so as to protect our mental faculties and all aspects of our health. Then my next question was, someone wanted to know what to recommend for liver cysts. So liver cysts are fluid-filled cavities in the liver, and they may be congenital, that is that they may have been there from birth, or they can also be due to certain kinds of parasites. So here the person did not specify which kind, but again here, what we can say is to support the liver in its function, because remember that the liver is one of the extremely important organs in our bodies for detoxing and other things. So eliminate sugar and junk food, minimize carbohydrates and factory fats, because all these put a strain on the functioning of the liver, and definitely eliminate alcohol use if you have liver cysts. Then on the supplement side, we recommend chelated zinc, we recommend beta-GAD, and multimineral alfalfa. Another question, or rather group of questions, wanted to know what to recommend for acid reflux, GERD, and gastritis, and those stomach issues that are related to heartburn and stomach upsets. And I put them all under one umbrella of supplements, because they do tend to be related. So the lifestyle side, we recommend avoid eating near bedtime, or in other words, avoid lying down after a meal, especially a heavy meal, because that horizontal position is going to worsen the acid reflux. Then also the issue, for some people, they may find that legumes, that is different types of beans and peas and so on, can make the thing worse. Others, for example, can find coffee to be problematic. So try to avoid the foods that trigger the reflux as you are getting dealing with it to resolve it. Then also include in your diet fermented foods such as traditional foods from our diets, from our cultures. I think every culture here in Africa and even European cultures do have fermented foods that they incorporate in their regular diet. And this will help with gut health. And gut health, of course, is going to, once the gut is healthy, it resolves these problems itself. So include those in your diet, the traditional fermented foods. They also bring in healthy microbes that assist us in improving our gut health. Then some people find relief by using acidified water, like for example, water with some lemon juice might bring temporary relief. And some people find that the problem is resolved by minimizing the carbohydrates in their diet, especially from flour-based foods. And maybe one can try that. Then supplements that will help. Aloe Vera Plus is going to be very helpful for gastritis. And this, we also recommend magnesium complex and fiber tablets to support gut health. The next question was about throat cancer. So again, in Neolife, we treat cancer as one illness that manifests in many different ways. And recommendation for cancer is also defense and Neolife Shake, because normally the treatment for cancer requires that you keep your strength up. And of course, chemo usually causes a lot of issues such as nausea, vomiting, and the sores in the mouth and so on. So Neolife Shake would be an important addition to phytodefense. So then another question was what to recommend for nasal polyps. Time before last. And these nasal polyps are connected to chronic irritation of the nostrils or the sinuses. So sinuses and support are usually found on either side of the nose, and they get irritated by allergies or if someone has got asthma and so on. And this chronic irritation will cause these types of swellings that, because then a lot of times doctors will not even recommend, because you will not have removed the cause of the polyps themselves. So for that reason, we deal with the causes of the chronic irritation. So first, the nostrils twice a day, especially after being in contact with allergens. Let us say you are allergic to pollen and you've been outside, maybe going for a walk or working in the garden and so on. Then it would be helpful to remove at least some of the allergens that might be there. Then also some foods worsen reactions. So maybe these foods can be avoided. For example, for many people, it is wheat and dairy that worsen the symptoms and the inflammation. Then flavonoid complex from Neolife is going to help with allergies a lot and with the healing of the irritation. We also recommend omega-3 salmon oil to resolve the inflammation. We recommend herbal respiratory complex. And although flavonoid complex does have vitamin C, you can also add vitamin C to the recommendations. So I see that my time is up for today. I want to thank you very much for the questions that you sent. I hope that you have found the answers useful and the questions as well, because by this, in discussing these questions, I find that we all get good ideas about how to deal with what we cross amongst our clients and our family members and friends. So thank you very much, and I look forward to our